Okay, here's one of those stories. Remember the old saying, "No good deed goes unpunished." I think this article fits it. Coronavirus: a nurse bought protective supplies for her colleagues using GoFundMe. The hospital suspended her. She raised more than $12,000 to buy and distribute protective gear for her colleagues who say they felt inadequately protected against COVID-19. How a confrontation in one of the nation's coronavirus hotspots illustrates a troubling national trend. So this is Newark Beth Israel Medical Center. Olga Mativskaya and her fellow intensive care nurses at Newark Beth Israel Medical Center in New Jersey were so desperate for gowns and masks to protect themselves from the coronavirus that they turned to the online fundraising site GoFundMe to raise money. The donations flowed in, more than $12,000, and Mativskaya used some of them to buy about 500 masks, 4,000 shoe covers, and 150 jumpsuits. She and her colleagues at the hospital celebrated, protecting themselves and their patients from the spread of the virus. But rather than thanking the staff, hospital administration on Saturday suspended Mativskaya for distributing unauthorized protective gear. Across the country, frontline medical providers and hospital administrators are butting heads about precautions against the coronavirus pandemic. Clinicians are being told to reuse or go without necessary supplies, even when treated patients infected with COVID-19. That goes against the way they have been trained. Some doctors and nurses now say they are being instructed not to speak to journalists and disciplined for doing so or taking action to protect themselves. Matiscaya spoke to ProPublica last week about the fundraising campaign. She said she had been able to purchase most of what the nurses needed on eBay. She did not criticize her administrators, and after her suspension, she declined to comment. But four other New York Beth Israel nurses spoke to ProPublica on the condition of anonymity about the dire shortage of gear. All four said their administration has failed to provide the supplies they need to protect themselves and patients. Two of them work in the intensive care unit, which houses the sickest patients. The other two work in other areas of the hospital. They said that Mativskaya showed leadership to keep people safe, where their hospital administrator has not. There was no information distributed about not being allowed to purchase supplies for others on staff, one of the nurses told ProPublica. The hospital told ProPublica in a statement that Matiscaya's suspension ended Monday. No employee is allowed to distribute unauthorized medical supplies within the hospital, the statement said. The nurse in question was temporarily suspended for inappropriately distributing unauthorized medical supplies. Now keep in mind there's a shortage of nurses in these hospitals, right? But yet this hospital has the luxury to suspend this nurse during a shortage when you overworking the staff, when the ICU is overwhelmed with so many patients in there, well, that they can't keep up, and they're begging for nurses to come in from around the country to help out. But yet this hospital has the luxury to suspend the nurse because she took donations and bought supplies, the PPE, personal protective equipment, that will help protect them because the hospital doesn't have the equipment or want them to reuse. The hospital said it ensures clinicians have the supplies they need by following guidance from the U.S. Centers for Disease Control and Prevention for reusing gear. You're not really supposed to reuse gear. We are working 24 hours a day, 7 days a week to ensure that the appropriate PPE gets to the right staff at the right time, the hospital said in a statement. It did not answer questions about what would become of the supplies purchased through the campaign or whether other nurses who participated in the fundraising might be subject to discipline. And she wrote, April 4th, she wrote, "Dear donors, thank you for your generosity. We are forever grateful for your support. In these hard times, we doubled our initial goal, and it was agreed that we have enough to keep us going for a few weeks. At this time, I am closing the campaign. Again, thank you so much for your kind words and your kind giving heart. Stay well, stay healthy. I love you all so much. Olga." The confrontation in New York but Israel may foretell what's coming in other cities. Northern New Jersey, just outside New York City, is one of the nation's hotspots, with more than 41,000 confirmed COVID-19 cases as of Monday. As of Thursday, the 665-bed hospital had housed 196 COVID-19 patients, according to an internal communication to hospital staff. Hospitals across the country have shortages of protective equipment, according to a report published Monday by the Office of Inspector General for the U.S. Department of Health and Human Services. Aileen Holmes, a clinician associate professor at the Rutgers School of Nursing, said she didn't know the details of the case, but was very surprised to hear of Matsuskaya's suspension. Hospital administrators are telling clinicians to reuse supplies, she said, which violates typical infection control standards. Suspending a nurse for obtaining protective equipment doesn't make any sense, Holmes said. That just seems counterintuitive and really not a good message to send your staff, Holmes said. The staff have a right to protect themselves. If the hospital can't provide the necessary supplies, they have a right to do what they need to do. They are caring for the sickest patients in the hospital right now. The situation is changing by the day as New York Beth Israel acquires and runs through its supplies. But the four nurses told ProPublica that they have often not been given the N95 respirator mask the CDC has recommended to protect themselves from the virus. One of the ICU nurses said for at least one shift, she received a regular surgical mask, which, in her opinion, is like putting a paper towel over your face. Some nurses outside the intensive care unit have been given a single surgical mask in a brown paper bag that they expected to use for an entire week. One nurse said. Nurses at other hospitals around the country have made similar statements. The shortage of gowns has also been a big problem, the nurses said. There should be enough to discard a gown after each interaction with an infected patient, but the shortage of gowns has required staff to leave the same gown hanging by the door of an infected patient room and reuse it throughout a shift. In at least one case, no gowns were available, one nurse said, so the staffer had to use a combination of a patient gown and bed sheet to treat an infected patient. Some nurses in the intensive care unit have been caring for COVID-19 and non-COVID-19 patients on the same shift, the nurses said. So if they're not properly protected, the nurses said, they could pick the infection up on their mask or clothing in one room and carry it to the other. The nurses said they have heard of hospital staff testing positive for COVID-19, but they don't know where they picked it up, and the facilities administration doesn't make any total numbers known. We are spreading it and we are getting it, one of the nurses said, of the coronavirus. The nurses said the situation is especially desperate because the hospital performed organ transplant operation and those patients have compromised immune system. A ProPublica report about the quality problems in the transplant program last year led to action by regulators. The hospital made the corrections required by the federal and state regulators, it said in a statement. The FBI also investigated the hospital as a result of the story, but the agency declined to comment. Monday, the nurses said some of the non-COVID patients are heart and lung transplant recipients. We understand this is what we sign up for, one ICU nurse told ProPublica. Just provide us with sufficient protective equipment so we can give these patients the optimal care that they need. So we aren't contaminating others or ourselves. In some cases, nurses and administrations have disagreed about what is needed to keep them safe. The intensive care nurses said they have asked for jumpsuits, the overalls that cover the entire outfit, but administrators have told them such equipment isn't required, they said. The intensive care nurses said they are directed to call a command center when they need more supplies. But when they reach out, you get yelled at sometimes, one of the nurses said. The hospital did not respond when ProPublica asked for an explanation of the various conditions described by the nurses. You see? And this goes on, and it said this is not due to a lack of money. The chief there is paid, Chief Executive Officer Darrell Parry, paid more than 1.4 million in salary and compensation. So it's not money. And the hospital also has lots of assets. So it's definitely not money. It's just being cheap. So that's what it is. That's what's going on. You see? So you put yourself on the line out there, and the people above, they don't really give a damn about you. And that's a lesson, you know? I see people coming out of retirement to help. Hey, you know what? If something happens to you, you get sick, you die, you'll be lucky if they show up at your funeral.